Good morning, all. I would like to welcome everyone present here today for the 17th meeting of the Joint Select Committee of Human Rights, Equality and Diversity. The committee's first public hearing into a follow-up inquiry into the recommendations of the second report of the committee of the 11th Parliament into the challenges faced by persons with disabilities, with specific focus on access to services and employment. I'd like to remind members of the listening and viewing audience that they are invited to post or send their comments via the Parliament's various social media platforms, the Facebook page, Parliament, and the Parliament's YouTube channel and Twitter. I would also like to mention that this is a hybrid meeting. There are members who are online, and the protocols that we would have had previously would apply, such as the muting of your microphones when you're not speaking. That applies to here as well, and also any devices that may interrupt us during our proceedings. I would like to facilitate the introduction of all the representatives who we have here to us today. Starting off, I'm just going to call the list of entities that are with us this morning. CODO, which is the Consortium of Disability Organization, the Ministry of Social Development and Family Services, the Ministry of Labor, the Ministry of Rural Development and Local Government, the Ministry of Health, and the Ministry of Works and Transport. Can I have an introduction of your team by the members of CODO, please?
Sudhir Ramisa, our board member, the Consortium for Disabled Organizations.
Go ahead. Stephen Crease, CEO of the National Center for Persons with Disabilities and member organization of CODO.
Good morning, Chair and committee members. I am Angelique Taylor from the Ministry of Social Development and Family Services, and I'll just allow my colleagues to introduce themselves.
Good morning. I am Tessa Pascal, Disability Affairs Specialist at the Ministry of Social Development and Family Services.
Good morning. I'm Stephen Abiraj, Deputy Permanent Secretary in the Ministry of Works and Transport.
Good morning, Chair. I'm Cindy Hiralal, Coordinator of the NGO Unit at the Ministry of Social Development and Family Services.
Good morning, Elizabeth Villarreal, Acting Director, Social Welfare, Ministry of Social Development and Family Services.
Good morning, Chair, committee members. I'm Claude Bayer, Project Analyst with NITCO.
Hi, pleasant good morning, everyone. My name is Visham Ramnanan, Automotive Licensing Officer 2 attached to the Licensing Division.
Good morning, Chair, members. Mr. Patrick Gomez, General Manager, PTSC.
Good morning, everyone. Rosamie Witzia, Head of International Affairs, Ministry of Labor.
Good morning, Chair and members. Umalisa Baldeo, Acting Director of Research and Planning at the Ministry of Labor.
Good morning, Chair and members. Natalie Willis, Permanent Secretary in the Ministry of Labor.
Good morning, everyone. Abdul Mohammed, Legal Officer 2 at the Ministry of Rural Development and Local Government.
Good morning, Chair and members. Annaline Innes, Deputy Permanent Secretary, Ministry of Rural Development and Local Government.
Good morning, Chair. Good morning, everyone. Brian Armour, Chief Executive Officer of the Southwest Regional Health Authority.
Good morning, everyone. Michael Reed, Deputy Permanent Secretary, Ministry of Health.
Hi, good morning. I'm Chairman Dr. Mohammed Yunus Ibrahim. I would like to have the members of the committee who are present to introduce themselves, followed by those who are online after.
Good morning, Anita Haynes Allen, member.
Good morning, Jillian John, member.
Members online?
Good morning, Shamsa Kudjo Lewis, member.
Good morning, Chair. Keith Scotland, member.
Good morning. Ian Francis, member.
Thank you all. I'd just like to remind everyone that the primary aim of this inquiry is to examine the extent to which the committee's recommendations regarding the challenges faced by persons with disabilities, with specific focus on access to services and employment, were implemented. At this point in time, I would like to get welcoming statements from the different entities. I would like to start with Mr. Sudhir Ramasa. Oh, sorry. Or would you be handing over to Mr. Crease? Mr. Crease?
Good morning. Good morning, members of the Joint Select Committee and other representatives here present. One of the things I hope to get across today is a retake or a relook at the definition of disability. I think we need to be in the direction of recognizing that is a question of vulnerability around which we should focus when we are thinking in terms of identifying disabled groups. Apart from that, there are some factual pieces that need to be clarified, which is a nice way of putting it. And also a recognition of what is possible, what is programmed, and what actually exists on the ground. I hope that during my time here, I would be able to shed some light along those lines. Thank you.
From the Policy Planning and Development Ministry, Ms. Taylor.
Thank you again, Chair. The Ministry of Social Development and Family Services welcomes the opportunity towards this very important discussion with the Joint Select Committee on improving the access to services for and the employment of persons with disabilities. Now, while the Ministry has oversight for addressing the social challenges of poverty, social inequality, and social exclusion, we do recognize that disability issues require a multidisciplinary response and therefore needs a whole of government and a whole of society collaborative approach to achieve full inclusion. The Ministry continues to be encouraged that our internal and external partners understand their responsibility and have their respective roles in social inclusion by ensuring that services to the public are accessible to all citizens, including persons with disabilities. So we look forward to today's discourse to garner enough feedback to take back to our ministry. And we thank you again for the opportunity to be here. Thank you.
Thank you. Ms. Willis from Permanent Secretary of Ministry of Labour.
Thank you, Chair. The Ministry of Labour is grateful for the opportunity to participate in this inquiry into the challenges faced by persons with disabilities, with specific focus on access to services and employment. This follow-up inquiry is indeed timely, as the Ministry of Labour has been prioritizing the greater inclusion of persons with disabilities in the workplace in its work program, especially over the past year. In April 2023, the Ministry started meeting on a quarterly basis with the Trinidad and Tobago Blind Welfare Association to address some of their concerns with respect to the employment of persons with disability. As a consequence of these meetings, the Ministry has established an internal committee comprising representatives of its key divisions and units to better understand and address the challenges faced by persons with disabilities in obtaining employment and retaining jobs. Propelled by our engaging discussions with the Trinidad and Tobago Blind Welfare Association, our brainstorming at the level of the internal committee, our collaboration with the Ministry of Social Development and Family Services, and the commitments made in the National Policy on Persons with Disability. The Ministry of Labour is currently implementing a 12-month plan of action to foster greater inclusion of persons with disabilities in the workplace. This plan is centered on the 3 R's, creating 1, ready employers, 2, ready employees, and creating a ready environment. Actions in the plan include sensitization of internal staff to facilitate better interaction with persons with disabilities, capacity building, development of a questionnaire to gauge the employment needs of persons with disabilities, development of a questionnaire to be administered to training providers in the OJT program on their willingness to place persons with disabilities, and finally, sensitization of employers and employees of the rights of persons with disabilities in the workplace. The Ministry of Labour therefore stands ready to assist this Joint Select Committee in its deliberations to provide any additional information or clarification and to receive any recommendations to assist us in promoting greater access to decent work by persons with disabilities. Thank you.
Thank you, Ms. Willis. Can I hear from Mr. Michael Reid, please? Deputy Permanent Secretary of Ministry of Health.
Good morning, Chair and members. I am particularly pleased to be participating in this follow-up inquiry on the recommendations of the second report of the Committee, 11th Parliament, into the challenges faced by persons with disabilities, with specific focus on access to services and employment. The Ministry of Health remains committed to upholding our mandate of providing the highest quality people-centered healthcare services to all, including the most vulnerable groups in society who are currently living with disabilities. During the last meeting of the committee, various aspects of the healthcare service areas were highlighted for the sake of clarification and information. Discussions involved the attainment of reports for visually impaired persons, as well as the ministry's manpower plan in relation to a holistic range of services, which is equitable to everyone. We were able to provide pertinent information for the sake of clinical analysis by the committee, and an aerial view was observed by the Ministry of Health in relation to the activities of the regional health authorities in providing equitable, efficient care for the benefit of the most vulnerable groups. Members of this committee and my dear colleagues, it is our unwavering position that persons living with any type of disability should be afforded the opportunities for employment, equitable access to services, and the option of financial or other public assistance from various arms of the government. With this in mind, the Ministry of Health is pleased to be part of these meaningful consultations, which can only yield greater protection for these vulnerable groups in society, while transforming the current landscape for the benefit of future generations. Thank you.
Thank you, Mr. Reid. Can we hear from Ms. Annalene Innes, Deputy Permanent Secretary for the Ministry of Rural Development and Local Government?
Good morning, Chairman, members. Thank you for the opportunity to be part of this very important discussion. It is our hope that our contribution will add value and lead to the improvement of the lives of our differently abled burgesses. We recognize that our role is critical for ensuring safe access and infrastructure, and we look forward to today's discussion and the opportunity to contribute meaningfully to improved service and service deliverables for our vulnerable citizens. Thank you.
Thank you all. I would like to start this morning off. My apologies. I left out someone, Mr. Stephen Abiraj, Deputy Permanent Secretary of the Ministry of Works and Transportation.
Good morning, Mr. Chairman and members of the Joint Select Committee. Good morning to fellow witnesses. It is a pleasure for the Ministry of Works and Transport team to be among this distinguished gathering of key and influential stakeholders at this follow-up inquiry, with a view to providing updates on matters before the committee. The Ministry of Works and Transport would like to assure members and stakeholders of its commitment in assisting the committee in fulfilling its mandate towards the promotion of measures designed to enhance the equalization of opportunities towards improvement in the quality of life and status of all peoples, including marginalized groups, and towards the creation of an inclusive and more equitable society through greater social justice and sustainable human development within Trinidad and Tobago. This morning, the ministry's team stands ready to respond to questions that may be posed by the committee and to provide clarifications requested to the best of our ability. We also welcome further recommendations and advice from members which can assist in mitigating any challenges identified and faced by persons with disabilities as we move forward. I thank you.
Thank you very much, Mr. Abiraj. I'd just like to remind all persons present today to address all your questions and concerns and statements through the chair. And just be reminded that when you finish with your contribution, just to please take the microphone off. I would like to start with the Consortium of Disability Organizations, CODO, particularly Mr. Crease. Mr. Crease, it's been 6 years since papers were laid and we had gotten back responses. I believe 2017 was the year that we last would have gotten official responses from ministries concerning the joint select and its findings in the laying of the papers in 2016. The report. Where are we and how are we? Have we progressed? As it applies to the focus of those with disability, has there been a level of improvement based upon the tenets of what we are looking to achieve this morning as it applies to job and access, employment and access of those with disabilities? An open question to you, sir.
I am inclined to argue that there has been some level of material improvement in terms of the kind of financial wherewithal of organizations, as well as the actual persons who these organizations are advocates for. However, in terms of the cohesiveness of the state programs, I think that is still problematic. And therefore, the question as to whether we have advanced significantly, the jury is still out on that, to be quite frank. A particular concern we have at the center is the question of the definition, right? Conceptual clarity as to what constitutes disability in our society. And there's a tendency generally in the media and the press to view disability, quote unquote, in terms of a physical impairment, when disability invariably goes beyond that, in terms of mental disabilities. But in the particular Caribbean situation, Trinidad and Tobago situation, we do not pay enough attention to the fact that there are some systemic issues that arise from our particular history. And I'm referring here especially to that expanded definition of disability as being a condition affecting people who can be defined as being vulnerable. And in that regard, vulnerability has to be a term utilized in societies that are post-plantation economy. I think it is chairman of the Caribbean Commission on Reparations, Professor Sir Hilary Beckles, who consistently makes the point that the diet and lifestyle that came out of the slave and plantation experience generally has had an ongoing systemic impact in terms particularly of the diet and the nutritional patterns of the groups who form the labor force, not just in Trinidad and Tobago or the Caribbean, but across the Americas. And therefore, viewed from that perspective, the incidence of diabetes, which is rampant across the world, but even more so in the lower income groups of the Caribbean and the Americas, places those persons so affected in a very vulnerable position. As a matter of fact, the arguments from PAHO, Pan American Health Organization, suggest that diabetes forms part of the wider problem of disability in the sense that, and I think Tobago rises for world recognition as having among the highest levels of amputations as a result of complications of diabetes. You see, the problem with that slave diet, as it were, is that it results in problems in insulin management and sugar management generally. And therefore, it impacts all the critical organs. So the statistics coming out of the United States of America suggest that at least 25% of the patients, of the cardiovascular surgeons, of the oncologists, in terms of cancer, in terms of lung, kidney, brain function, heart, all of that, 25% of their patients are in fact diabetics. So that the high incidence of amputations in Tobago, for instance, is directly related to this feature. And therefore, and we could include those who are visually impaired, because 25% of the people between ages 40 to 75 have vision impairment problems as a result of the onset of diabetes.
Mr. Crease, if I may, you're speaking of the definition aspect and how wide you can go with respect to vulnerability.
Yes.
Yes. So I would just like to remind the viewing and listening public, according to our Equal Opportunities Act, Chapter 2203, and this is for the purpose of the definition here, so that you can lend a word or two with respect to if it needs to be adjusted, or what would you suggest? The disability means total or partial loss of a bodily function, total or partial loss of a part of the body, malfunctioning of a part of the body, including a mental or psychological disease or disorder, or a malfunctioning or disfigurement of part of body. That's just as a reminder and for the listening and viewing public of the definition within the Equal Opportunities Act. I mean, throughout other acts, they have mental health act, they have other things, but the definition you're speaking about, exactly what part would you like to, that doesn't encompass what you're saying with respect to vulnerability?
Well, the problem is perception, in the sense that to the extent to which the society perceives the connectivity between the onset of diabetes and the disability, the direct disability that it impacts. So amputations, for instance, and the high incidence of that in Tobago is a reflection of that. But viewed through the conventional lens, there's no sense of that connectivity. Good. Okay. So we keep looking for people with walking sticks and wheelchairs and spectacles and so on. And that is really, particularly in our situation with the high incidence of diabetes, that in fact is down the road, is what's waiting for you if there's poor management of your condition. But I would leave that alone for now. It was just to make sure people understand that in our situation, the statistics that are available, which most of the analysis is based, is a bit skewed if it does not recognize the role that diabetes plays in all of this.
Noted. Member Haynes had a question for you.
Good morning again. Mr. Crease, in your opening statements, you said something that I thought would be very instructive for all of us since we are examining the recommendations of a previous report. You said that we'd go over what actually exists on the ground, what is possible, and what is programmed. Given the entities that we have here today, I think that a very important starting point for us would be for anybody here to tell the committee, one, firstly, in terms of the recommendations coming out of this 2016 report, what is actually existing on the ground now? And then if you give us the idea of what is possible, we can find that gap in what is programmed. Because if we are not programming for what is possible, and if we're missing something that is actually existing on the ground, I think then we can use all of the entities present here today to take us from where we are to where we need to be in terms of the fulfillment of the recommendations.
Right. The reason why I'm focusing so heavy, and I intended to move off at this point from, the connectivity with diabetes and all the other impairments, has to do with the prescriptive remedies. Because if you don't recognize that in the back room of the amputations of the, what you call the eye impairment,
retinal detachments,
right,
and vision, yeah.
Good, and I myself had 2 of those operations in terms of, that situation. The thing about it is that your budgeting in the Ministry of Health has to take attention to that. And I'm not talking about the prescription drugs that are made available via CDAP. I'm talking about preventative care.
Yeah, Mr. Chris, thank you very much. I understand what you're saying, but it brings me to a question just to, I'll come back to Mr. Sudhir shortly, Mr. Robinson shortly. However, I would like to have a person from the Ministry of Health. And it says, I'm asking the question, what is the status of the implementation, taking into consideration what we're speaking about? What is the status of the implementation of the National Strategic Plan for the Prevention and Control of Non-Communicable Diseases in Trinidad and Tobago, 2017 to 2021? Because it definitely speaks towards the preventional aspect of disability that Mr. Crease is alluding to.
Good morning again, Chair and members. The Ministry of Health has established a national a non-communicable disease unit in the ministry to roll out the strategic plan for NCDs, treatment and care in Trinidad and Tobago. And that unit has been working to ensure that the data that we need to effect some of the changes that are needed in the system is there, and also to sensitize persons concerning NCDs and the effects that it has in terms of as Mr. Crease was speaking about disabilities in that regard.
But from what I'm hearing, and I must ask the question, if it is that we speak of non-communicable diseases and we speak about its prevention through lifestyle change and lifestyle management, and we recognize that it does play a role in the genesis of disability, shouldn't the ministry in its outreach program identify such possibilities to the public that if it is that your non-communicable diseases are unchecked, these are probably the things that can happen?
Through your chair, I'd like Dr. Amor.
Sure, but before he does speak, just whosoever is in the last row, because for recording for Hansard purposes, they don't have a visual of you all from the side. You can just identify your name, whosoever in the last row will be speaking.
Hi, morning, Chair. I'm Dr. Brian Amor, Chief Executive Officer of the Southwest Regional Health Authority. In terms of the strategic plan for non-communicable diseases and the policy role of the ministry and the implementation role of the RHAs, it follows a life course approach following the discussion. So it actually starts in utero through the Directorate of the Women's Health, where we have a vibrant national program about managing diabetes in pregnancy so that the unborn doesn't get a genetic predisposition or comes into this world with a family structure that has that young infant or neonate at risk in later adolescent and adulthood to become diabetic, and as well as to have become at risk for becoming vulnerable under the broad disability definition that was just enunciated. So that program occurs through all the regional health authorities, and that is actively followed up as one arm. As we go through childhood programs in schools, we have vision and hearing screening. We also have obesity targeted programs for children who are obese to ensure that those risk factors are flagged and highlighted, and the health education, more so for parents and teachers, tries to create a healthy environment in schools and at homes so that children could manage their predisposition for adult onset disease. For the adult programs that we tend to be more familiar with when onset of diseases occur, the particular ones mentioned for diabetes through the NCD plan and the National Committee, as well as the role of the RHAs, we do have a deeper architecture this time of programs that basically start from screening for diabetes to determine if you're pre-diabetic. We also have in hospital and in health centers eye screening programs that involve a collaboration between specialists in hospitals coming out into some select primary care centers, and also training up of our primary care staff, those staff who work in the health centers, so that we pick up early onset of eye disease. We also have launched in a more aggressive way diabetes foot care clinics. So persons who are known diabetics and have any risk with their feet for developing ulcers or loss of sensation, there are medical interventions to detect those, and that sort of interventional aspect is occurring at our health institutions. So those are the sort of examples that starting in utero, delaying onset as much as you can through healthy lifestyles, prevention approach. We have a lot of community engagements, health education. Even if you still do develop the diseases because of our genetic imprint and what is being implied in terms of our societal perception of risk of disease, as well as our lifestyle, even if you develop those onsets, we also have those sorts of interventions that could assist in control. And therefore, should you still be beset with amputations and or eye or sight-threatening disease, specialist interventions at that point honestly could only go so far, and which is where ultimately there's still need for all of government approach to address persons who still come out on that side of the life course with different disabilities or vulnerabilities, and for which, as stated, we are willing to work with all partners to ensure that that is mitigated and persons can still live a quality of life despite their disability. Thank you.
Thank you very much, Doctor, for your contribution. I would like to ask Mr. Ramesa, who had his hand up a little while ago, to make a comment.
Mr. Chair and members, I'm going back to your first statement where you asked, over the last 6 years, what actual tangible differences between there and now. And being a disabled person, and sir, I am 58 years. I've never walked in my life, so I have been my whole life like this. I cannot sit here and tell you that I have seen, physically could say, yes, I've seen changes in the last 6 years. And I am very much independent person. So I'm very curious and really eager to find out what was and what is today from the members, because I lived the life. And when you live the life, you must observe what is making your life easier, because there's still difficulties in terms of accessibility to any aspect of my everyday life. So that's why I'm wondering what is there that actually has been done. Because I know we signed on to the UNCRPD, the conventions. I know we still basically a long way off from legislative part. Because I mean, when you think about it, is that there are a number of things that could be done to get it rolling out. One of the most important thing for me is that we should have legislation when it comes to building codes, because to start with, if I can't access a building, makes no sense I even go into it. People with a disability, and when I'm not only talking about person with a wheelchair, people who are visually impaired, people with hearing problems, every person who has a disability, if there's not a degree of accessibility, and whether it be to society generally speaking, then we are not going to be inclusive. Our society will never be an inclusive society. Thank you very much.
Ms. John, you wanted to say?
Thank you, Chairman. Thank you, members. I just want to continue with what Member Haynes Allen had asked and Mr. Ramesa just started to respond to. I think it is critical that we start from where we stopped before in 2016, and someone need to tell us, give us the gap. That is what the gap is, 2016, there was a major committee that really had some inquiries, and the findings were very critical and went to the heart of a major deficiency in our society, where we are not looking after our vulnerable. Never mind, we have the Constitution that talks about equality, we have the UN Convention, we have the legislation. But it appears, if I'm to note what Mr. Ramesa just said, nothing has changed. So what I want to hear from maybe is the Ministry of Social Development, who is probably the lead on this in terms of bringing together all of the stakeholders. What has happened since then? This report would have come out since 2016. Did you bring the stakeholders together and say, okay, fine, these are the findings, and basically how are we going to proceed?
Thank you very much, Chair, through you. I want to respond to the member. Ministry of Social Development has been very busy, even though not so visible, but we have been working on our legislation, our disability bill. Back in 2019, we would have finalized and obtained cabinet approval for our national policy on persons with disabilities. A disability assistance grant for minors, and that is children under the age of 18 who are medically diagnosed as severe and complete. We have also continued to conduct education and sensitization for frontline employees in both the public and private sectors. We continue to provide financial support to state agencies, state bodies, example, TAHI, Trinidad and Tobago Blind Welfare, Lady Hochoy, and their respective homes, as well as we are taking steps to resource our Disability Affairs Unit under the Ministry of Social Development. We recently received approval to go ahead and to recruit a director which was one of the issues that came up at the last report. Yes? So these are some. I don't know if the team members would want to contribute through you, Chair.
Thank you, Director. Well, I wish they will, because we are talking about 52,000 of our citizens, about 4% of the population. That's in the report. And it could be more than that. And we are talking about children. Mr. Ramsey said he has never walked inside. Going about, you see many children who are disabled, and the parents have an impossible task of looking after that child, and as you move up. But this report, they speak about deficiencies in transportation, in housing, across the board. So basically, the grant, this and that, someone has to take a lead role in looking not only at this report, but because given where you sit, folks are going to be coming all the time if you can't access. I'm seeing where people can't access government services, right? And we are building new infrastructure. So it must be that we have to look at, are we going to retrofit, or are we going to ensure we have the codes which take into consideration the fact that people cannot access services? Because the disabled in our society are some of the most vulnerable in our society. People can't access public transportation. There are not enough buses, even if there are buses. And then they say call on demand. If you don't have buses for people who are able-bodied, I can't imagine they have the logical that they have none for people who are disabled. Education system. I'm seeing somewhere where out of 400 and whatever secondary schools, only about 50-something caters for the disabled. We should be ashamed. I was ashamed reading this report, quite frankly. That we really are so immune to our people who are disabled. And this morning, coming after 6 years, without an answer, I really can't feel good about that as a citizen of this country. All right, so I'm hoping that someone has taken a lead role and this thing is not disjointed and all over the place and bit by bit and so on. Somebody could tell us from 2016 to now, this is what we have done in the various areas based on this report, because people are taking the time at the level of the parliament to really do this inquiry. And then it is up to our public servants, the operators, to do something, to action it. And as far as I'm concerned, no action has been taken. And again, I'm saying we should really be ashamed as citizens of this country.
Before the response, I want to recognize the hand of Mrs. Member Scotland, who would like to make a contribution. Member Scotland? You seem to have your microphone muted. Okay, sure. Keeping that note and that point of questioning alive, which Member John was stating, you are part of the planning and development, yeah? What level of coordination and spearheading has your ministry taken? And with those represented bodies here, especially in addition, the CODO in membership, have you engaged them in the plans moving forward? And what we're hearing right now is that the legislative side is in its making. Although you got a cabinet note, I believe I read somewhere that it was issued as a white paper somewhere, has reached that stage. However, how is levels of coordination with Ministry of Planning and Development with respect to physical infrastructure? Yes, you have to retrofit. We see a lot of retrofitted public buildings, but moving forward in building codes. However, we also have seen over the last few years such things such as ramps retrofitted onto buildings for access. We've seen pavements, sidewalks. How is the entire process going for a user-friendly, may it be a capital, may it be a nation? Are we looking at it at this point in time, being the lead coordinated ministry for this?
Thank you very much, Chair, for your question and your concerns, members. There was an interagency committee that was formed in order to monitor and to implement the convention, the UNCRPD, as well as the national policy for persons with disabilities. The life of the committee came to an end in 2023, 22. And thank you. And so that we have taken steps to reconvene and reconstitute because we recognize that one or two of the more important ministries and agencies were not part of the original composition. In addition to that, in terms of the accessible codes.
Ms. Taylor, which ministry would you state was critical and omitted, and what moves have been made to include them in this committee?
Through you, Chair, just allow Ms. Tessa Pascal to answer.
Thanks. Chair, we did not on this initial committee, we did not have someone from gender affairs, and we felt that was important for the community of persons with disabilities, as well as someone from, we had housing. Because the ministries were split, we had to, with youth development, we had to get someone from that ministry, all right? Yeah. So we would have had someone from the previous ministry, but when they split it, we had to request someone from youth and national development because we believe persons with disabilities can be involved in that aspect and can benefit from that aspect of both the national policy and the UNCRPDs. So, sorry.
Sure. Member Scott, are you ready to make?
Yes, Chairman.
Sure, go ahead. Yeah.
Chairman, in the United Nations Convention on Human Rights, and I'm piggybacking from your approach and Member John's approach on human rights with disabilities, that convention was ratified in June 2015. So it sort of precurs this, what we are inquiring about today. The Ministry of Social Development also in June 2015 submitted a legislative policy to give effect to the United Nations Convention on Human Rights of Persons with Disability. The Ministry of Social Development is currently in the process of preparing a draft bill. Chairman, could they tell us when, through you, Chair, may I ask, what is the status of this bill and what is the timeline for laying this bill in Parliament? That's my first question.
Thank you very much for your. The ministry is currently receiving a second rounds of feedback from different stakeholders. We would have received at least 7 agencies and ministries. We have 4 outstanding. Of course, we could always provide that in writing. And right, the NGOs would have already received information and feedback from our NGO partners. I don't know anybody else. Yeah, so.
Chairman, we have still not gotten. I find, and I don't know if the other members would agree with me, if we don't set a target timeline, it becomes lost in file 16. Chairman, could you give, through you, Chair, can you ask that we be given a sense of timing for this, please? I understand that 4 outstanding, etc., etc. What is the timeline?
Chair, through you, allow Ms. Tessa Pascal, who is a member of the Legislative Committee in our ministry.
Thank you, Chair. So we are compiling the comments into the second draft. That second draft should be completed and resent for comments because we want another group of persons to comment on it as well. Some people that would not have seen the initial draft of the document. And that, I believe, should occur by the end of second quarter. While we are doing that, we are also working on the accompanying legislative policy. So once that is completed, and we look at third quarter for that, that will not be completed until we have a final proposed draft legislative document to go forward to the, who drafts services and the CPC, right? So we are looking at possibly the end of this fiscal to have everything in place to send that to CPC.
All right. Chairman, again, through you, and I'm saying this so when you do your work, we don't have to come back, because I'm giving a bit of advice from my limited experience. The United Nations Convention on the Rights of Persons with Disability, that policy also suggests and mandates that other pieces of legislation be in consonance with the policy and the legislation, because then it will make no sense, Chairman, if the attendant legislation is not in sync with what we are doing. Have you all considered the Equal Opportunity Act, and particularly the Motor Vehicle and Road Traffic Act? And two just came to mind that would necessarily be needed to be amended to be in conformity with the United Nations Convention on Human Rights. Have you all considered that? What is the current status of the review of those pieces of legislation to be in conformity with the United Nations Convention on the Rights of Persons with Disability?
Thank you, member, for your advice. Those pieces of legislation are not under the purview of the ministry, but I believe, and I share your view, that it can be considered by part of the legislative committee. Yeah.
Well, Chairman, it not can. If you look at it, it ought to be considered, because the legislation that you are looking at now will encompass and affect at least these two pieces. Chairman, I haven't looked at the others, or I haven't considered the others, but when I come up with a chair, I will undertake, I've already given two. If I come with more, I will undertake to provide them to you, and it's an advice which you can accept or you can reject. Chairman, I have one more question in this round. Do you not think, and Member John and Chairman, you also referred to it, Section 4 and 5 of the Constitution does create the concept of equality before the law, equality. Don't you think maybe, because constitutional reform is now a very hot topic, don't you think that maybe now advocacy should be done with respect to the actual inclusion in the Constitution of the rights of those who exist with disabilities? Chairman, can I hear the views? And this is my last question on this round of questions.
Thank you very much, member. Just allow Ms. Pascal again to make her contribution.
Thank you, Chair. Again, in reviewing the policy, in putting the legislation together, we are considering the impact on other pieces of legislation, because like Member Scotland said, those two are not the only pieces of legislation that will be impacted by this new legislation. Some things the new legislation will override. Some things we will have to get amendments for legislation for. And we are also considering the impact on the Constitution, because some of the things we are asking and seeking in the bill will have some constitutional impact. So we are looking at it in that holistic manner.
Thank you. Staying with Ministry of Social Development and Family Services, I would like to ask a question. You did say that we had the interagency committee. What are the short-term and long-term objectives of the committee? I know you stated that the committee was disbanded since 2022. And what is the status of review of the initial report on the implementations of the CRPD which was submitted to the UN Committee Rights of Persons with Disabilities.
Chair, if you permit us, we would want to provide that in writing for you.
Okay. So the interagency committee would have met. You would have been able to reach out to other ministries, and you would have also been able to reach out to different levels for the purpose of fulfilling the initial reports. Although you would like to state something in writing, where are we on the infrastructural aspect? Because they would have had planning inside that interagency task force, and in addition to that, they would have had some level of works, transportation, and everybody else inside there. I'm asking you all as the overarching ministry in charge of driving this process forward. Was there a target? Did you see yourselves having to say, okay, fine, with respect to access, has the recommendations been fulfilled? I mean, we're hearing a lot about the legislative aspect. We're not hearing about the infrastructural and the deliverables that was clearly listed out in that report when it pertains to employment, access, usability of the general, within the general public space for those with disability. Can you tell us where the checklist has reached in that aspect?
Thank you, Mr. Chairman. We would have prepared, from what I'm being advised, we would have prepared some letters to the various agencies to remind them of their individual responsibilities and their roles on the committee. And we can provide, again, because the information, we don't have it at hand today, would want to provide that in writing for you.
Member Haynes would like to make a contribution.
Thank you. So as we are on the point, one of the points of accessibility, and giving due consideration to Mr. Ramesar's point earlier this morning, the committee would have met in 2016, as Chairman said, and then they would have sought further responses from the various ministries. And I have in front of me a matrix. One of the report recommendations in 2016 was that the Ministry of Planning and the Ministry of Local Government and Rural Development should review the stakeholder facilities infrastructural access recommendations from the committee. There was a response from the ministry, from these ministries, which stated that the Town and Country Division within the Ministry of Planning would meet with CODO and provide the necessary training and sensitization with rights, etc. The Ministry of Local Government would have also responded, Ministry of Local Government and Rural Development would have also noted that they are a key player in the economic development of the country, and that they would also be using this approach to focus attention on rural communities in terms of the provisions of services and amenities. So this is from Ministry of Planning and Ministry of Rural Development. The town, in responses to the follow-up questions, which would have been put to the Ministry of Local Government, and I'm using Ministry of Local Government and Rural Development because we don't have members from Ministry of Planning here today, right? Right, so unfortunately for you, Ministry of Rural Development, you will get the focus of my full attention because Ministry of Planning is not here today. But I'm seeing in front of me that the response to the follow-up question was that meetings would be held within the first 2 weeks of May 2017, and that the conversation would have started in 2017 as to how we can utilize Ministry of Local Government and Rural Development, Town and Country Planning, Ministry of Planning, to get more accessible spaces, that the guidelines would be in place. And so because I am an eternal optimist, I am hoping that I would hear today from those discussions what would have been put in place and where we would be post the discussion, since May 2017 is quite some time ago. So if that question is to the Ministry of Rural Development in terms of your discussions with CODO, your discussions with the various stakeholders in terms of providing a policy and providing a framework for accessibility of public spaces under your purview since 2017.
Good morning, Chair, again. And thank you, Member. Thank you, Chair. What I can say in relation to where we are with the accessibility to public spaces and the meetings that were supposed to have been held, unfortunately, I don't have the documented minutes of those meetings. What I could speak to, however, is the recent meetings we have had with Ministry of Planning, which is coming out of our local government reform legislation, the operationalization. Now, what would have happened since the 2017, when this committee would have met, you would have had the refinement of the legislation as well as several joint select committees, I believe there were 2, and you would have had the passage of the local government, the Municipal Corporations Local Government Act in 2022. So since that time, what the ministry would have been working on with all our key stakeholder ministries is engaging in discussion with them as to how we could operationalize the aspects. And I think that is what the response was in relation to. At the time when that response would have been prepared, the legislation would not have been fully crafted, but since that time it has been refined. So what we have been doing recently, and since 2022, and I dare say probably before as well, is engaging with our key stakeholder ministries, and Ministry of Planning is one of those key ministries where we are looking at how we can operationalize those aspects that fall under the Planning and Facilitation of Development Act. Now, one of the challenges that we are facing, Member and Chair, at this point in time, is that most of those sections, in terms of the critical enabling sections, have not been proclaimed. Now, we are aware of what is there in terms of the requirements for the creation of a code, etc., which I believe is what CODO is what they've been focusing on. But the proclamation of those very important sections is what I would say is holding us back at this point in time. Now, we have had several meetings with them, at least 3 with the Ministry of Planning, as we seek to deepen this particular discussion. And we are hoping in the near future to get closer to the refining the codes, etc., the discussion on the codes. What I could say, though, is that currently, the Ministry of Planning and the Ministry of Rural Development and Local Government, we would have agreed to set up a committee to look at, what we could do with the municipal planning authorities, which of course is what affects the functions under the planning bill. And so that discussion is continuing. We also have a member at this point in time on the National Planning Authority, who they are the ones who really are spearheading what is supposed to happen under the Planning and Facilitation of Development Act. And so we are hoping that we can take the discussion in terms of access and accessibility to infrastructure to a better place. We hear the comments, and of course we are open to receiving critical feedback. What I can also say, though, is that we would have reached out to the corporations just as a means of supporting the work that is being done at this committee to get their assessment of where they are. And in most cases, well, if not all, because we didn't get responses from 2 corporations, but those that responded indicated that they do work along with town country planning guidelines, which does incorporate some universal standard of accessibility, especially in the new infrastructure. In terms of retrofitting that the chairman would have mentioned, there is a bit of a challenge there in the sense that a lot of the corporations, they do occupy rented facility, and they may have done that for a very long time. So retrofitting those rental facilities may be a little bit difficult. But other than that, with the new facilities, for example, the Diego Martin Administrative Complex, that is constructed in accordance with the proper standards of access. We are, again, open to receiving any further comments and feedback that could help the committee and could allay any fears that persons have with respect to how we are approaching improving access to persons with disabilities.
Just one quick follow-up. So I'm hearing that there's a significant amount of collaboration between the Ministry of Rural Development, Ministry of Planning, etc. Where are the stakeholder organizations like CODO or any other organization that speaks directly from the perspective of persons living with disabilities included in these discussions?
Chair, if I may, we have not yet deepened the discussions to that level. I think what we are seeking to do, first of all, is make sure that both pieces of legislation, which is the Planning and Facilitation Act, as well as the Municipal Corporations Amendment, Local Government Act, both of them could be proclaimed, and then we could deepen the conversation with in terms of implementation. As a first at the first part, what we are doing is dealing with the higher level so that we could get the operationalized version of the legislation. And then we will move deeper to meet with the other stakeholders. But the door is not closed. And we take your point. Perhaps we can include them at an earlier stage so that we could use their feedback to guide our further discussion.
I would strongly suggest always including the voices of those who would be most impacted by the work that is being done at the earliest stages, because what we find is that we start discussions and we continue discussions for decades, and it remains as a discussion. And when we get to implementation, those who are most affected are going to be affected by the implementation. So if they're not included, then we will find ourselves in a very circular pattern of inefficiency.
Mr. Ramsa, you wanted to say something? Okay, Member John?
Thank you, Chairman. With respect to the this interagency committee, I didn't see the Ministry of Housing referenced, but I think it ought to be referenced because the persons living with disabilities, they are discriminated against with respect to housing, whether it is the cost of housing or the access point to housing. I think there exists a cabinet note dated maybe 2002, where there's a special allocation provision for 5% of the houses to be allocated to people who are differently abled or senior citizens. So one can also look into that, but I think it's important that the Ministry of Housing sit on this committee. In addition, Chairman, there was a service launched in 2012. Well, I suppose by the Ministry of Works and Transport through the PTSC for the elderly and differently abled mobile persons. To you, Mr. Chairman, can the representative from the PTSC kindly update us as to what is the status of that service, please? The current status of the service. If it still exists, what has happened and what are you doing about it?
Before you answer Ms. John's, Member John's question, I would like just to briefly point out, in support of what she's saying, the stakeholder transport recommendations based upon to the Ministry of Works back then. Yeah? And it's stated here, the transportation recommendations back in 2016 was for persons associated with visual impairment, more working Eldamo buses are required to adequately service the population of persons. Within regular buses, there should be assigned seating for the first two rows. And a number of recommendations that were given along things for the hearing impaired, blind welfare associations, squeaky wheels, and a lot of intertwined Twine talks about the service and also in the upgrading of the current bus services. So please proceed with the question in that light, please.
Thank you for your question, member. The Eldamo service, yes, it continues to exist, though it is hampered by the fact that it is an aged fleet. The fleet is around 12 years old. We are currently undertaking an extensive exercise at doing some repairs on that fleet internally on the existing fleet. That is ongoing at the moment. We provide service.
The fleet, you didn't give the number on the fleet right now. What is the
There were 24 original buses. One was involved in a major accident, so it came down to 23. We have roughly identified 18 buses, right, for detailed repairs and refurbishment, including servicing of the ramps and so on, and that is ongoing at this point. We run the services out of San Fernando, and that provides service for some of our persons with disabilities on a daily basis. And we also provide out of Port of Spain on as-need basis if we get a request through the Ministry of Social Development. Additionally, daily we provide a free service to the Blind Welfare Association from Sandy Grande to Port of Spain. That service is ongoing and a daily Monday to Friday service. Through the school transport service, we provide, as requested through the Ministry of Education, we would assist with regard, and we have one service that provides for the school to the blind. So that is in terms of that. In terms of the Eldamo fleet, we continue to work to make it as workable as possible. We have made recommendations to the Ministry of Social Development on a relook at the entire system and how it is delivered, and those recommendations are with the Ministry of Social Development at this point.
So if I'm not mistaken, you said you had 24 buses. One was in a vehicular accident and 18 are down for detailed repair.
Well,
so you're basically stating that there are 5 available buses.
No, they're not down for detailed repair. We have identified 18 of those to undergo some detailed repairs and so on. Some of them are operational at this point. We have around 12.
12 out of the initial 24.
Yeah, that are
okay.
Operational, but we have gone a little more in depth in terms of body works and so on. So we are pulling them out of the fleet to look at them and get them back up.
So and how is this service coordinated? The telephone lines are open still. How do you advertise, and how does the end user know that this process is still alive and the service is still available?
Well, out of San Fernando, it's a traditional group of persons with disability that we provide. Other persons may make requests, and we have gotten requests through the Division of Aging from time to time in the Ministry of Social Development. Once that is requested, we put the arrangements in place and deliver the service depending on the nature of the service.
I am sure that besides your regular user, right, there are individuals who would need mobility services. Where is the outreach to those individuals? And how does it reach them?
And that is one of the parts of the system that we are relooking as to how those calls are screened, how are resources identified, and a priority given to requests. So that is one of the feedback we gave to the Ministry of Social Development going forward, that we need to look at that aspect of the system, because what you have is persons calling in a very ad hoc way to request these services. Given the limited resources, there has to be some decision making, which I don't believe should reside with PTSC. It should reside at the Ministry of Social Development in conjunction with PTSC.
You enlighten us as the process of the calling, what happens, and for example, with respect to the depleted fleet right now and availability of buses, what type of time frame does it take to, like, for example, develop a ticket for a user to actually get access to the service.
Let us stop what you're working on now.
Member Scotland, your mic is unmuted.
Yes, Chair. I would say within 48 hours, a call comes in, somebody has a schedule that they require. We would look at the resources, prepare the resources, and provide the feedback for them. So within 48 hours, they can get.
I might also assume that there was a level of training for the operators of these buses and services. And can you tell us about the training that happened? And if there is an ongoing level of refresher as it pertains to the assistance of the disabled through the service?
All right. Yes, there was an initial group of drivers identified for the Eldamo service. Those drivers have been reintegrated into the daily scheduled services. We have 27 buses that have universal accessibility, wheelchair ramps in those buses. So one of the things we have recently started was to include training for all drivers to operate those ramps on the buses, which is our open service buses. In terms of the proposed new fleet, it is expected that 210 out of 300 proposed buses would have universal accessibility. So therefore, this has to become a mainstream of training in what we call our recertification training for all drivers of the corporation. One of the gap areas, the driver is there to drive the bus. Persons with disabilities may require assistance from time to time. And the issue of the paratransit assistant came up. We fed into the cabinet note that was being prepared by Ministry of Social Development. We gave them our feedback in terms of job description and what the paratransit assistant will be required to do, and that is with the Ministry of Social Development at this time.
Sure, Mr.
Yes, CEO. You said persons call on an ad hoc basis. If that is not in keeping with the service, how should they then call? If you say ad hocism is perhaps based on what you said, is not part of the parameters, what then is the preferred way they should call?
Well, what we are looking at with social development is a system where they manage the persons and make the recommendations to us, and we deliver the service on a daily basis. The paratransit assistant is also an addition to that, whether it comes from the Ministry of Social Development and is embedded in PTSC to provide that service on a daily basis.
I have a difficulty with that, quite frankly. I mean, they say, how many things will they manage? You are the transport expert. Why will you want them to manage this thing? Already someone has to call 48 hours in advance. So we are assuming that persons living with disabilities doesn't have any emergencies if they have to call 48 hours in advance. The other question I want to ask, the buses you are proposing to be receiving, how imminent is that how imminent is that input into your fleet, one? And then will it be coming as one set of buses, or will it be delivered in tranches?
Can I just piggyback something on what Mr. John is asking? I have a problem with the question with the bus service. Yes, 200 and something out of 300 and something buses with a probable training of a driver and hopefully persons on the buses to assist the special needs of the user. However, how are the people coming to the buses? So is there a plan? Is there a plan to maintain the Eldamo and bring persons to main hubs where they can then expect to be transported with the new fleet? Because there is a piece I'm missing something, and I would like you to help me here. if someone normally picks up like your regular users from San Fernando, you go to their homes. Okay, these people can't find, and there isn't infrastructure along the way from their home to the bus station or the bus terminal. What is the level of integration for the planning for persons who need to be picked up and then integrated into public transporting and then back to their homes? Are we seeing it as the El Damo will also increase? Or are we leaving everything to the buses on the normal routes?
Well, what I can say on that note, Chairman, is that there has been no instruction to discontinue the El Damo services. Can't speak to expansion, but there has been no directive to discontinue. What has been envisaged is that the regular scheduled buses will provide universal accessibility to persons with disabilities who choose to use those services. In terms of, you may have to remind me of your question, member.
Jesus Christ.
Chairman.
Just now, please.
One moment, Member Scott.
Relax himself. CEO, what is your difficulty with customers calling you directly, whether they are disabled or not, or people with disability or not? What is your difficulty? Why should they be channeled to the Ministry of Social Development?
There's no difficulty, member, with regard to persons calling directly. But given limited resources, there is a level of, for want of a better word, triaging that goes on there. And we are saying that this is a collaborative effort with the Ministry of Social Development to deliver the service. That's all I'm saying with respect to that. But we have no problem with the calls that come in, and when they come in, we take them and we address them accordingly.
Right, exactly, because why do you want to put another layer onto a system that doesn't even work well as it will? You will know your capability. Say someone calls into you, you could say yes or no. But if they have to call social and then they call you, don't you think that is too many layers of people already living with so much challenges?
But it is open for discussion, and we are in discussion with social development with regards to the best way to deliver. So yes, member, I'm agreeing with you to an extent. Yes.
Okay, so you'll forget about this thing, because I think that is abdication of your own responsibility. You're just trying to, you know your capability. You know if you have 10 buses, 12, and as a matter of fact, your system probably not working at all. Because if you have had 24 buses since God knows when, and you're now looking to look after 18, and you wait until they're falling apart to do critical retrofitting on them, it must be, and maybe the Ministry of Social Development can tell us whether that system is working. Does it make sense for people to even call it? Director of Social Development.
Thanks very much, Chair, to you, and thank you very much, Member, for your concern. I want to confirm that yes, we are in discussion with PTSC for the revival of the service, but more so.
Sorry, you said revival. That gives the impression that the service now.
Full service. Not the part service, not only part, just full service. Yeah. Right. So that they have presented 3 options to the ministry, and so one of the options would be for the ministry to purchase the buses. The other option would be for us to collaborate. In other words, PTSC would procure the buses, and we would provide the software services where we coordinate how persons are transported. And the other option would be similar to the school bus model, where we have maxi taxis, utilizing maxi taxi service. So we're still deliberating which option that we would go with.
So, Chairman, but so the maxi taxi service, does these buses have the capability even, or they will have to now retrofit?
Through you, Chair, I'd allow Ms. Tessa Pascal to respond.
Thank you, Chair. It is a service similar to the maxi taxi service, so it wouldn't necessarily be using the present maxi taxis, but assuming that people will have vehicles that are accessible for persons with disabilities to utilize.
I just find me going around the mulberry bush, sorry. I don't understand what's happening here.
Those were the options we were presented with.
What are we trying to solve here? We are trying to give access to persons living with disability, right? The transportation expert presumably is PTSC. Don't take on burden that you don't have to take on, right? Let PTSC buy the buses, buy the government, right? They will know, they have engineers who will know to spec those buses, and they will just tell you how many buses they have. And you don't take any calls, as far as I'm concerned. They call PTSC. What are they calling you for? You can't give them a service. Let PTSC deliver the service that they are paid to do.
Member Scotland.
Thank you, Chairman. Chairman, I want to go back to, I want to advance the concept of the collaborative effort. Can I ask the Ministry of Planning, through you, Chair, what provisions are in place for the direct involvement of NGOs relative to persons with disabilities in the drafting process and in the consultative process of your policy and legislation? I have a follow-up question to that.
Member Scotland, regrettably, we don't have the Ministry of Planning here with us today.
So can I ask the Ministry then of Social Development?
Certainly.
Thank you again to you, Chair. Member Scotland, yes, we do have, we have reached out to different persons in the fraternity and the civil society fraternity, especially our partners in the disability fraternity, to provide us with some feedback on the disability bill. As I mentioned before, we are currently in the second rounds of consultation, and so that and we would have already provided a timeline in terms of being able to come to some sort of conclusion before we pass on the draft bill to CPC for continued action.
Chairman, again, a question. Chairman, when we have these meetings, sometimes we may have to invite other agencies like the Ministry of Education, because, Chairman, through you, again, we know that the education policy is all-inclusive. What is being done relative to teaching aids in most classrooms with specific measures as it relates to having teaching aids for persons who live with disabilities as a standard operating procedure in schools?
Is that an open question to anyone here?
Chairman, the Ministry of Education is not before us, so it's open to those who are involved in policy, open for those who are involved in the day-to-day operation. But I think it's a legitimate question for this JSC.
Sure. Mr. Kreese would like to propose an answer.
The National Center also runs a school and a vocational training school. So in that regard, we have a perspective on this whole issue. And our contention is that there should be mainstreaming. We have a problem with the segregation of persons with disabilities. So at the entrance point, we think the system is off in a wrong direction.
So, sir, my question to you then is why is there not the aggression? So, Chairman, what is being said is that, look, the segregated schools are not in line with the all-inclusive policy of our education policy. So therefore, we want all-inclusive. Why is that not being done now? Where is the plan for that to be done as a matter of urgency, sir?
Something definitely to be taken on by the Secretariat for the addressing. I remember Haynes wanted to ask a question.
Thank you. I was actually still at the synergy between PTSD and the Ministry of Social Development. So Member John asked, what is the problem that we're trying to solve, right? PTSD has a mandate to provide safe, clean, inexpensive transportation service to the people of Trinidad and Tobago. That's a mandate specifically. There is no disaggregation of who the people of Trinidad and Tobago are. That is your responsibility. As we are meant to do as responsible policymakers and executors, is that you have to use data to properly provide and implement your service. The data that you would require would come from the Ministry of Social Development. Now, if the Ministry of Social Development, you have these grants, you have disability grants, etc. As a member of parliament, I know that when persons will come into the office, they would provide a certain set of requirements. They have to show the need, and they'll come to you, Ministry of Social Development, and say, okay, this is my particular difficulty. These are the things that I'm applying for. And so you have a file, you know who the persons are, etc. And therefore, in that, the only way I can see or understand all of government approach working is that once you know who is trying to access your services at the Ministry of Social Development, the communication then is made to the ministry, to PTSD, to say that these are persons who would require, these are the areas, or you would see you look at either geography, you look at where the need is and say, okay, well, you need to provide your service along this way. This question of when people reach out to us, we will provide the service, or if somebody reaches out, we'll get in contact with them. If you exist in the service space of Trinidad and Tobago, you'll know that the persons who know a service exists, they will access it all of the time. They'll access multiple services. They know every avenue in Ministry of Social Development. They know exactly who to call in PTSD. They know every step of the way. And the persons who don't know, the persons who are not involved in that system, who did not have the benefit of someone walking them through the process, they will never be able to access any of these systems. And so meeting that mandate of providing a service to the people of Trinidad and Tobago, you are not able to do it because there is no, as far as I've heard so far, and from PTSD, you can enlighten me, there is no advertisement, no communication. How are you reaching the persons that you're expected to provide a service for? Because what I'm hearing is that we expect that persons requiring a service have to reach out to you, but you're in the business of a customer experience. Persons with disability are customers of PTSD as well. And so therefore, in the provision of this service, how are you reaching the persons who to let them know these new buses are coming anyway? This is what is available to you.
And I totally agree with you there, member. The one part I would like to focus on is the part you spoke about people making registration and being available and then being sent to PTSD. And that is one of the areas we are looking at the collaboration strengthening. So once people are screened and so on, and they are advanced to PTSD, we have that standing list of service that we can provide to that person, those persons through the Ministry of Social Development. So it's there's no one fixed state. I agree with you also that there may be persons who are not aware how to even access a service, and that is something definitely we will look at going forward.
Right. Mr. Chris?
Chair, 4 times over the past year, I have, because of requests from students and trainees at the center, sought to ascertain the status of the service. The last time I did so was at 9:05 this morning, and I was told that that service is not in operation at this time. And that has been the mantra for the previous calls I've made over this past year.
I saw a shaking of a head in the back. Would you like to comment on anything based upon that last?
I think what I will have to do is have a conversation afterwards with respect to that. The issue is,
and there was one thing I wanted to ask you. You said 48 hours for response. Can that 48 hours be no?
No, 48 hours to put the system in place. From the time you get the call, we will determine whether it can be done. We put everything in place for the system.
And we didn't quite get an answer when it applies to the training of and sensitization for the disabled. How is that extensive training? Or is there a program?
Well, we have
outside of just being able to operate the lift and bring someone into the bus.
We have a number of drivers that was assigned to the Eldamo services, and as once we are providing the service, we utilize those drivers that have been trained to interact with persons with disabilities.
Mr. Ramasa, you wanted to make a comment?
Mr. Chair, member, question is that this 48-hour timeline for requesting the service and getting, should I say, access to the service? What about it? Let's see, I'm going to use myself as an example. If I call for the service, let's say for tomorrow morning, that's not 48 hours, right? What system you have in place for, let me use the word ad hoc situation that develop? Because I'm very independent, but if I get up in the morning or the day before something happened to my vehicle that I drive, what is there for a person like me? Because I've never been screened, etc. And I face an ad hoc situation where I have to report for work for whatever reason. What is the system in place for to address a situation like that without the 48-hour screening, etc.?
And that is what we are looking at with regard to the revitalization of the service. At this point, that will be a gap. That will be a gap. But if it's, I'll use the San Fernando service. That is a daily service offered to persons who regularly and daily utilize the service. So once you go through that process and you're on that, then that service will be continuously provided. Right? In terms of the other part, if it's an ad hoc service, we require time to get things in place logistically.
Clearly, the system needs some steroids to basically boost itself up to be available to people who need it on a more real-time basis as opposed to what is occurring right now. I would like to move on. Oh, sorry, my member wants to comment.
I have one question on school transportation, and I'm referring here to the matrix in front of me. In this 2016 report, there, as I said before, follow-up questions were sent to the ministry and sent to PTSC as well. Coming out of that report and looking at the inclusiveness of the school maxi taxi transportation program, consideration will be given to the number of students with disability that currently utilize the service to get to school and encourage maxi taxi providers to procure maxi taxis with universal access in the future. So that's from the ministerial report to the committee in 2016. The follow-up question was whether or not PTSC had collaborated with the Ministry of Education to encourage the inclusiveness of the school maxi taxi transportation program. And they asked you to include meeting dates, etc. The information I have here in front of me is that in the past, PTSC collaborated with the Ministry of Education on a meeting in September 2007, and that the PTSC will seek to re-engage the Ministry of Education in the matter once again in the near future. Just so that we can be clear in terms of where that collaboration is, whether or not PTSC is aware of the service that they need to provide to students with disabilities in this to get access to school. Where are you getting your numbers? Is it a real-time data collection? Is it that we are dependent on the ministry to reach out to you or a school to reach out to you? Or are you actively seeking the information? Walk me through the process.
Yes, member. Thank you for your question. In terms of the school transportation system, we get requests through the Ministry of Education, who gets the request from the principal through the school supervisors and so on. They provide the numbers, they provide the timings, and the school and the origin of the trip and the destination. All that is provided to us through the Ministry of Education. Based on that, we would then provide, identify somebody who can deliver the service. So any requests for school children with disabilities would come through the Ministry of Education in that respect, right? We do provide one such service at this point in time, right, for school to the blind.
I would like to bring into the discussion this morning the Ministry of Labour, and I would like to ask a question. Has there been an analysis or survey to determine for certain industries to gauge preparedness and willingness of the private and public sector to accommodate persons with disabilities for employment?
Thank you, Chair. With regard to your question, I believe in the report we would have indicated that in 2017 we would have done a survey of certain employers to determine their willingness to hire persons with disability. Recognizing that took place approximately 6 or 7 years ago, we have decided and we have developed a questionnaire to administer to the 1,600 training providers in the OJT program. For the purposes of the OJT program, they are called providers, but for other purposes, they are employers. And they are in the private, public, and NGOs that we are looking at. And we are seeking from that information, we will be able to disaggregate the data into the different industries, the type of business, the size of the business, so that we'll be able to know that, okay, in this particular industry, they're willing to hire, or these number of industries, they're willing to hire persons with disabilities, and these others, they are not. And we are also asking, what are the barriers to you for you from hiring persons with disabilities? What are the accommodations you have put in place to hire persons with disabilities? That survey, all things going well, is supposed to go out today. In speaking with the division, because it's the OJT division that is administering the survey, we are looking at receiving responses by the end of this month.
Thank you. What is required to alleviate and monitor discriminatory hiring processes across the workspace, public and private? Do you receive complaints? Nobody wanted to. I approached for a job. I applied for a job. I was interviewed and I wasn't hired. Discriminatory. And is it because of a lack of understanding? And you mentioned something that people have to be willing to hire. I'm assuming the willing to hire has to do with preparedness of his space. Because if somebody is not willing to hire somebody, that could be discrimination. So how are the hiring practices going, and are you seeing levels of discriminatory actions not to hire?
Through you, Chair, the responsibility to treat with discrimination in employment would reside with the Equal Opportunity Commission. I'm not aware of any recent data coming out from the EOC with regard to discrimination in hiring persons with disability.
Just Mr. Ramasa, anyone in your membership who is willing to work and applied for work, has anybody ever reported any levels of discrimination throughout the years.
Mr. Chair, I will not be able to tell you for sure. The President might be able to further clarify that for you. I will seek the answer and I'll get back to you all on it.
And thank you, Chairman. On the question of willingness, you said it's preparedness, whether or not you can facilitate. So from the Ministry of Labor's perspective, has there been any analysis, any survey in terms looking at industries, looking at sectors across, in terms of how persons are preparing? So from the ministry's end, do we have any data in terms of industry sectors, whatever, that they're moving towards being prepared so that we can get away from the question of willingness, which I find, inherently discriminatory?
So as I indicated, we are now going to administer that questionnaire, and that questionnaire would provide that data.
And what is the timeline for the completion of the survey?
We are expecting to get back the responses by the end of this month.
And then from there,
from then we will do an analysis of the responses.
And is there an internal timeline for the preparation of the report?
By April.
Thank you.
Coming right back to the Ministry of Social Development and Family Services, I need to ask, does the department, the Disabilities Affairs Unit, is it adequately staffed and resource funded to meet its mandate? Because there seems to be an air of lack of timeline and reaching a sustainable point of, okay, we have developed the infrastructure and the law. Is your department lacking when it comes to staff and resources?
Thank you, Chair. The staff of the Disability Affairs Unit comprises of 3 persons. The positions, I think it's 8 persons. So as I mentioned before, we have received approval from Service Commission to go ahead and recruit a director. The other 3 persons who currently comprise the unit are 2 disability specialists, one of which is here, as well as a business operations assistant, and we have to also have to recruit, and we have to recruit any more. We also have to bring on board a research officer and 2 BOA ones.
The question the chairman just asked on the staffing led me to another question. As far as you're aware, are all the Ministry of Social Development offices and sub-offices inclusive and accessible? The physical structure.
From the last meeting, there was a project under our PSIP to have our offices accessible. That project has since been incorporated into a larger project, but the output from that previous project, we have 4 of the offices that were prepared, that were refurbished to include ramps, accessibility to bathrooms. One of the facilities that I'm speaking about has since been transferred to the Ministry of Health. That is the New Horizons in Paparo. In terms of the other buildings, they are not owned by the ministry, unfortunately. We're renting, and so that we have to approach the respective landowners to do the necessary refurbishments.
So as it stands, the answer is no. They are not. All the Ministry of Social Development and Family Services buildings are currently not fully inclusive and accessible to persons with disabilities.
Not all those that are owned by the ministry, the 3 of them, yes.
Understood. And therefore, Given that knowledge and given now, I mean, I intend to ask the question wider to all ministries but my feeling is if the Ministry of Social Development, which should be the first port of call, is not fully accessible, then how are we mandating wider? So given that we are aware that we are in rental facilities, we are aware that according to the ministry's mandate, you are responsible for executing policies, bringing equitable access to persons with disabilities, and that we are aware that there are rentals. Where are we along that process of engaging the owners of the property so that the answer would be yes, they're all fully inclusive and accessible?
We are engaging with those landowners to prepare the buildings and to refurbish the buildings. Actually, the ministry is engaged with UDCOT to construct a main head office, and the expertise in the disability affairs unit, they have been able to provide some of the requirements in order the guidance for the access to the new building. We are also in the process of relocating some of the boards, some of the local boards, so that the boards at Port of Spain, we're trying to get that relocated to another building. So of course, we have to have those lenses in order to ensure that we are accessible to persons with disabilities. We're also going to be relocating splitting the boards in Tunapuna to have one in Arima, as well as we're looking at Shoguanas and to place maybe another board in a closer vicinity.
Sure. We have heard, not just from your ministry, but from the back as well, that the argument was used that it's a tenanted building. And I'd just like to remind you that if the legislation is drawn up and passed, rented or not, all buildings will be able to be accessible by law. Simply put. So the standards and the building codes will have to be there, and it will have to be a checkpoint of criteria for all persons who are renting buildings, whomever, public or private, for it to be wheelchair accessible and user friendly for the disabled.
Yeah, just Chairman, the PSIP project that you mentioned, that was from 2017. That would have been allocated to deal with buildings owned by the ministry. So that PSIP project does not encompass any of the rental properties or anything like that. Okay.
Thank you, Chairman. Thank you, Chairman.
Yeah. You want to proceed because you wanted to lead on something on habits.
Thank you.
And I'm sure he would use this opportunity to in the next stage when we may be submitting.
Yeah, because we need to wrap up. Yeah, yes, Chairman, through you to Director Taylor again. Your job by its very nature is one that requires collaboration with the other state agencies. Will you say that they really is very responsive, kindly responsive, or not responsive at all?
Through you, Chair, thank you very much for your question, member. We have had a very close relationship with our state partners, especially with our ministry partners in our planning processes, and more recently with respect to the drafting of the disability bill. Yes, there is room for improvement, especially with our state boards, our disability fraternity. I think the ministry needs to be a little more engaging with our fraternity, especially in the planning process, where we would need to have them be from the initial stage straight down to implementation stage.
Director Taylor, to Chairman again. I want to say, not you specifically, but I just want to say, basically, this report has been lying there since 2016. And we really, as a committee, as far as I'm concerned, have not really had a real any idea of where we are with respect to managing our different behavior. This is not targeted at you, I'm just talking about us as a society. So I don't expect you to be able to answer this question I'm about to ask, but if you can send it in, because it has to do with the Ministry of Education, actually. And the report says that the ministry has received other types of, complaints about lack of ramps, accessible washrooms, and multi-story schools. And these are just basic everyday needs from our people, students, etc. And at the time they had a construction program targeting 40 primary and 8 secondary schools as opposed to retrofit. But at the time of the writing of this report, of the 427 primary schools, only 50 were accessible to persons living with disabilities. And at the secondary schools level, we have this big community that, without an education, without training, we are really committing people to a life of great depravity and lack. So is it that we are going to be more aggressive in terms of taking a fresh look at this report? What do you think is going to happen after, given that you are the woman in the middle, as it were? You have that unfortunate role. What will happen after this? Because this is not a talk shop, Correct. This really, and we are live, the country is seeing it, and they can't be happy with respect to what is being revealed here today.
Thank you again. Thank you again. Through you, Chair. Just to say that there is an opportunity as we're now drafting that disability bill. The issue that the member would have raised seems to be one of enforcement. And if it is that certain pieces of the legislation are not proclaimed, then how can we put these systems in place in order to have proper enforcement? With the drafting of this disability bill, I think it would be very fortuitous to have us incorporate some of those areas and address some of those issues through the bill, since it might have a little more teeth.
Chairman, as Member John noted, the purpose of our committee here today is to assess the implementation of recommendations made years ago. So we aren't in the business of discovering anything. This is nothing new is here. We are assessing recommendations. Now I asked a question to the Ministry of Social Development and Family Services about the accessibility of their offices. We have officials from Ministry of Labour, Ministry of Health, Ministry of Works and Transportation, Ministry of Rural Development here. If you could each in turn take that question and tell me if your buildings are all inclusive and accessible as well, just so that we aren't going to redo. We just want to know in terms of accessibility whether or not currently ministries in service of the people of Trinidad and Tobago, if all people of Trinidad and Tobago can access your services physically coming into the spaces.
You want to start with the Ministry of Health?
Sure.
Thank you for the question. With respect to the health facilities in the ministry, which would be Ministry of Health corporate headquarters, vertical units, and all the health institutions, a large portion of them would be, definitely the newer structures would be disabled friendly, for want of a better word, in terms of your wheelchair ramps and access, in terms of provisions for parking for persons who are driving or depending on vehicles and need to get parking close to entrance and exits. And we do have our quality departments, customer service units that would take any internal complaints from patients, visitors, or staff on any issue, including issues and feedback to us about these challenges to access. We also have washrooms that will be dedicated and so forth. So the newer facilities are standard, and the percentage, I don't have those data. We probably have to put that back in writing if the committee so desires it. But in the Ministry of Health overall, we are mindful, and we do have the ergonomics and the infrastructure in the majority of instances, as far as I recall, that would be addressing those issues of access. Thank you.
PTS. Ministry of Works, PTS.
Mr. Chairman, the Ministry of Works is a vast ministry with many points of presence. I'll request that we defer the response to that question. However, I will indicate that the head office on Richmond Street does accommodate, and I can indicate that the member from Kodo is an employee on my floor, so he is accommodated in the main office.
Okay, let's still on the ministry. I mean, I know we have another gentleman here in the middle row concerning licensing. Licensing departments, how well equipped are we with respect to access for the differently abled? And specifically, I would like to know, for example, people who have to get their license and tests under specific conditions. Do you put it to specific locations and branches that they must go and do these examinations? If they have to come in to renew, what do the individuals face, and how easy is the system for the differently able to utilize?
Thank you very much, Chair, for this question. Pertaining to persons who would initially come to have a renewal done at the licensing division, we have accessible for the photo room, which is ramps, and it depends on case-by-case scenario with certain persons who are bound, like paralyzed from waist down. Well, the vehicles will have to get inspected to make sure that the apparatus or the device is assembled properly into the vehicle. Pertaining to persons who now are applying for a driver's permit, these have to be assessed properly first, depends on the disability as well. And yes, this is be facilitated at the 7 branches we have in Trinidad and the one in Tobago as well.
So somebody could wheel themselves up to the counter and ask these questions?
Yes, sir.
Okay, great.
Yes, sir. Thank you very much.
Ministry of Labour, I'll get to PTSD. Yeah, Ministry of Labour.
Through you, Chair. I would have indicated in my opening statement that the ministry would have established an internal committee. Within that committee, there is our senior facilities officer, and based on information we would have received from the Ministry of Social Development and Family Services in terms of what constitutes accessibility to persons with disabilities. This officer would have started looking at all our offices, our head office, our sub offices. And while I can say the head office is accessible because we are the waterfront, so it's accessible. Our Duke Street office, he had indicated, is approximately 40 to 50% compliant with the listing provided by the Ministry of Social Development and Family Services. He has yet to go out to our sub offices because we spread throughout the country to determine the level of compliance for persons with disability to be able to access.
Thank you. And I guess given that you have a survey ongoing in terms of the compliance in industries, you would include the Ministry of Labour, and so that we'll get all of that data in a complete report. You said April. Yes. So same question to PTSD, and I asked the chairman's indulgence to say PTSD for last because within the same matrix, there was a discussion in the status of the feasibility study for the redesign of the transportation hubs, because in 2016, there was an acknowledgement that the transportation hubs are not in keeping with what we needed. And so that the response, the follow-up question that I have in front of me from PTSC is that PTSC is committed to inspecting the infrastructure at all its transportation hubs to improve the infrastructure and facilitate ease of access for members of the differently able community. The corporation recently constructed a wheelchair access in San Juan and Curep transit malls. So this was then. So I note that back in 2017, there was an acknowledgement that you were not fully accessible. So if we can get where we are now in 2024.
Well, we have been, it's an ongoing project of all our transit hubs. The terminals, we have added wheelchair access in those points. We are obviously limited by some of the infrastructure that we reside in. We reside in historical buildings and so on, which may limit our ability to retrofit. Any new construction will be in conformance with the code, and we have a number of those planned going forward. That will be universal accessibility. So generally, it's an ongoing project, and where we have identified areas that it can be improved, we are improving it as we go along.
And in terms of the timeline for this improvement, like do you have, how are you rolling out the infrastructure improvement?
Well, we did some wheelchair ramps last year, and again we'll do some this year out of our PSIP money based on the budget that we get. More or less, I would say we have finished Samoa, Curep. So we're looking at Tunapuna and Arima depots this year.
Very well. But everyone present, I'd like to thank you all. There was a comment from the Ministry of Rural Development. Yes.
Morning, Chairman. I don't know if the member wanted to hear from us again.
I did.
Okay. So in respect of the Ministry of Rural Development and Local Government, as well as the 14 municipal corporations, we have accessibility at, I could say, at 3 levels. There's full accessibility, limited, and no accessibility at all. And when I say that, I'm talking about the buildings themselves. Now, most of the corporations have reported that they do have disability parking, and they have ramps installed, and they have washroom facilities that are wheelchair accessible. There are several corporations that have indicated, like Sangre Grande, and I believe it was Princestown, that may have indicated that they don't have any accessibility at all. In those cases, as I said before, they would have been limited and constrained by the fact that they are rental facilities, and we are at the mercy of the landlords in those particular arrangements. We have to deepen the conversations with the Property and Real Estate Division with respect to those issues. As regarding the head office and the other new facilities, we have made strides in improving the accessibility. So we have done some retrofitting at the head office. Some of the corporations have indicated in the event that they don't have access, what they do is that they try to accommodate persons on the ground floor with assistance. And that is where we are.
Thank you very much.
Seem to have come to a relative end of our inquiry this morning and proceedings. What we can clearly state is that what we can clearly state and realize that there seems to be no sense of urgency as it applies to the fulfillment and in the delivery of the 2016-2017 report. The Secretary will have the task of reformulating the report based upon our findings today. And we do look forward to all those promised written submissions and also to see some significant progress in all matters discussed this morning. I would like to ask for closing remarks. And in those closing remarks, I would like to take the consortium last. Yeah. And I'd like to start off with the Ministry of Social Development and Family Services, followed by the Ministry of Labor, followed by the Ministry of Health, Ministry of Works and Transportation, Ministry of Rural, and then we will take the closing remarks of Kodo thereafter. And at that point in time, you can make your comment then. Ministry of Social Development and Family Services.
Thank you very much, Mr. Chairman. Members, it was indeed a pleasure to participate in today's session. We recognize that the work of social inclusion is not at the place where it should be. And we would want to see an acceleration of this work so that by next time around, there would be some significant achievements. We've taken on board the recommendations of the committee, and again, we commit to providing the committee with the agreed written comments and written information, especially in terms of the interagency committee. Thank you very much.
Ms. Wills, thank you.
Thank you, Chair. We would like to thank the committee for the opportunity to be here today to discuss the progress that has been made towards the inclusions of persons with disabilities. We note the concerns of the committee that there has not been significant progress generally. We at the Ministry of Labour, we remain committed to advancing the inclusion of persons with disabilities in the workplace, and we will continue to work with our stakeholders, particularly the Trinidad and Tobago Blind Welfare Association. We will continue to reach out to the National Center for Persons with Disabilities because we would have asked them to assist us in administering a questionnaire to approximately 101 persons with disabilities to determine their needs. So we will continue to work with our stakeholders in this regard. Thank you.
Good afternoon, Chair and members and colleagues. Today's proceedings really force us to look in the mirror and see where we are with our implementation of the recommendations of the last meeting. And we take what has been discussed very seriously. The Ministry of Health is committed to continuous improvement in our plant processes and in our people, so that going forward, we would see that the recommendations are fully implemented. And we want to thank you for the opportunity to be here to contribute.
Ministry of Works and Transport.
The Ministry of Works and Transport would like to thank the committee for the opportunity to contribute to this discussion on human rights, equality, and diversity. As stated earlier on, we give the undertaking that we will provide the information requested in a timely manner, and we look forward to pursuing discussions on these matters in the future. Thank you very much.
Thank you, Ministry of Rural Development and Local Government.
Good afternoon, Chairman, members. Thank you for allowing us to be part of this very important discussion today. We take on board the comments of the members and their concerns, and we commit to including that in our processes as we go forward. I think the process today has reinforced the fact that we need to be more mindful, reflective, and responsive in what we do. And as we go forward in our discussions with our stakeholders, we take the members' comments that we should include those persons in the decision-making process as we go along. So with that said, we want to thank you for the opportunity, and we look forward to receiving the report and any other critical observations or guidelines that we should take into consideration.
Thank you. From the Consortium of Disability Organizations, I would allow closing comments from both. Yeah?
Yeah. Again, from the conceptual standpoint, I think there's a lot of focus on access as being access and egress in that sort of physical way. And we lose sight of the fact that how one traverses these public facilities. Mention was made of works done at the hub in Samoa and I think possibly Tunapuna. I have here with me a proposal which we prepared on the request of the Maxi Taxi Association, in which we reviewed the facility, the Port of Spain Maxi Taxi Hub, and its limitations vis-a-vis persons with disability challenges. Good. And in this proposal, which we can make available to the committee, I won't go into details now, we speak to not just the placement of ramps to deal with wheelchair issues. The access and egress problems goes beyond people who are wheelchair bound. So we are talking all the modern facilities that those of us who visit Miami and New York City would see in terms of strobe lights and those are the electronic signals that people can make use of to traverse, unfamiliar territory. And these aren't exorbitant, and there aren't that many hubs in Trinidad that would require that kind of modernization. So I could make a copy of this report available. We did it free for the Maxi Taxi Association in July 2022 in terms of examining the Port of Spain hub and seeing what are its limitations and how it could be quickly and cheaply modernized. So that's one thing. The other thing that hasn't been touched on at all today is the question of access to justice for persons with disabilities. Again, available, there's a report done by UE, which was funded by the Canadian government, which reviews the entire Caribbean. And there's a section from pages 274 to 295 on Trinidad and Tobago. Again, in the interest of time, I won't go into all the details, but the report is available at UE. I would recommend that this be made available to the committee. There's also, of course, the UNRDP report, which again goes into all the kinds of details that we need to have access to. I would also want to point out that the the Caribbean Development Bank, CDB, has been conducting analysis, and I'm sure my colleagues at the Social Development Ministry is aware, because I think they were one of the co-sponsors, along with UWI, of that public consultation, so that the Caribbean Development Bank is conducting a policy-related study and program review across the Caribbean. And they held 3 consultations on the Trinidad and Tobago report during the course of last year. One, of course, in Port of Spain. The second was held at the City Hall in San Fernando, and the third in Tobago. So there is a Caribbean Development Bank report and the whole question of policy and program with respect to the disabled community. Again, I won't go into the details of that. The report is there, it's available. The Ministry of Social Development were attendant at that session, and they have copies, just like I have, of what is being recommended. Finally, the other thing that we need to pay more attention to is the question, and this is what I alluded to earlier when I said the disparity between what exists and the fine proposals or the legislation. Even though we don't have all the modern legislation, there are in the different pieces some amount of provision to deal with the whole question of access and, fairness in terms of egress from properties. But in the case of local government, I have to complain that it's a systemic institutional problem, because what has happened there is that the system of the inspectorate, particularly I'm referring here to the building inspectorate system, which is totally deficient. Because what has happened over the years with both the health inspectorate and the billing inspectorate is that they were merely reallocated from the original county council system. So this tells you how far back this flaw in the system goes, because the local government, previous local government act was passed in 1990 during the Nara administration. And much of what's in that was never implemented. That's the first problem. The second aspect of it is that the staffing for the building inspectorate was merely reallocated from the old county council system. So you had more entities, more municipalities created out in the new local government arrangement. But yet all they did was take the staff from the former county councils. So that most of these municipal corporations, the regional ones, have one, and I think maybe two have 2 billion inspectors compared to Port of Spain, who would have a full department of 4 and 5. The implications of that for ensuring that what's in any building plan, even if we had perfect plans with all the kinds of egress and concerns and toilet facilities that are required, even if it's there in the plan, the question of monitoring, of inspections, and we know in this country that in any long weekend and carnival coming is proof of that. And we have Easter, and sometimes like last Christmas, you have long weekends for those public holidays. Over those weekends, the number of structures that go up across the countryside is frightening. And its implications for one, not just the question of access and egress for, physically challenged persons, but the question of the safety of these structures in terms of anybody, including people who are in a wheelchair who are passing nearby. That aspect of the local government system, of the municipal system, is really, really scary. And I think that unless something is done in that regard, the disparity, the gap between the fancy designs that somebody may submit to the municipal corporation and what actually obtains on the ground is a huge, huge gap. And unless that is addressed, everything else is really cosmetic. A fine plan will exist on a shelf, but out there, what's on the ground, it's a entirely different story.
Thank you, Mr. Chris, for your very thorough and lengthy summation. I'm sure all has been recorded, and you still want to chat? Sure, go ahead.
Thank you, Chair. I'd like to say thank you very much to the committee and Chair for the opportunity. There's one thing I heard a lot of the members talk about, designated park. I'm going to ask a question of you all, not for to answer. When you go back, look at those parks, for example, you all designate a park, but the park is most times inadequate. For a person like me, when you open your car door, you can't because another car is parked. There's nowhere to exit or enter the car. So please, when you go back, you reclaim that we have a car, a parking allotment, etc. This last thing I'd like to say is that people with a disability, our disability is compounded because we live in an ableist society. An ableist society that prohibits or restricts our growth and our ability to contribute to national development. And as far as my knowledge, and most people agree, is that the true wealth of any country is its ability to harness the human capital. So until we don't get it right and include all people across the spectrum, we will never be a true developed country. Thank you, sir.
Point taken, sir. At this point in time, I would like to thank everyone and all officials for your attendance and your contributions to today's proceedings. And I would like to thank the committee members who participated both virtually and present, and most definitely the staff of the Office of the Parliament for your procedural and logistical support. and to the viewing and listening audience. Thanks once again, and the meeting is now adjourned. Oh.